Hello, everybody. Good evening. As you know, the month of October represents various important topics you and your family should be informed about. As we all know, it's Breast Cancer Awareness Month, and we do have an upcoming special section in our papers at the Herald community newspapers that you'll get to see about that. There are other awareness topics as well, and we're here today with AARP of Long Island, this is part of a three-part webinar series that we're doing, starting off right up front here. It's National Hearing Awareness, which we're covering today. Then we also have financial planning, cybersecurity awareness coming up. But we're all excited to bring you these webinars. Are going to be coming every Thursday evening right now, beginning tonight. I'm Michael Hinman. I'm executive editor of Herald Community Newspapers. I'm here with Bernard Macias. He is the Associate State Director of the AARP Long Island. Hello, Bernard. How are you doing?
Hello, Michael. I am doing great.
All right. Well, in the next 60 minutes, you're going to learn how to protect your hearing and understand what are some of the signs of hearing loss that you should not ignore. So let's get started. I want to introduce our panelists first here. Joining Bernard and I here, we have Esther Fogel. She is a doctor of audiology at Comprehensive Audiology. Dr. Esther Fogel is a clinical audiologist, is the owner and director of Comprehensive Audiology. She is a fellow of the American Academy of Audiology and a member of the American Speech and Hearing Association. We also have Dr. Lawrence Cardano. He is a doctor of audiology. Dr. Larry has been the director of the Hearing Center of LI since 1996. At the Hearing Center of Long Island, he and his staff provide advanced personalized treatment of hearing loss. And we would talk about how to pronounce this, but tinnitus, right? If I say that right, Dr. Larry? And help improve the quality of life and maintain relative cognitive function for thousands and thousands of patients. So welcome to both of you. And I think that, we wanted to kick things off and kind of show a little bit about what we're talking about here and what they should be looking for, talking about some of the signs of hearing loss and everything else. And so I believe Dr. Fogel, Dr. Larry, you have something you want to share with us.
Well, before we begin, folks, I just want to talk a little bit about AARP.
Oh, yes.
Yeah. So again, I want to welcome everyone tonight to this wonderful health webinar. It is a series, as Michael said. It's our health, wealth, and self. We did this, Michael, not too long ago, back a few months ago, and we're really excited to bring once again lots of information for all you wonderful folks out there. And again, my name is Bernard Macias. I am the Associate State Director for AARP on Long Island, specifically for community outreach and engagement. Right here on Long Island, I serve close to 500,000 members across all of Nassau and Suffolk. Nationwide, our membership is growing and strong at 38 million, and we have 2.5 million of those members right here in New York State. A little bit more about AARP. Well, we happen to be the nation's largest nonprofit, nonpartisan organization dedicated to empowering people 50 plus and older to choose how they live as they age. We strengthen communities. We advocate for what matters most. And with a special focus on health, security, financial stability, and personal fulfillment. So if you're going to remember anything about AARP, please remember we're all about health, wealth, and self. And that's why we're starting and kicking things off tonight with a great presentation on how to protect your hearing. Please make sure you're making notes to register for the following seminars that we have. We have one on October 13th, Wealth, how to protect your money. And then on October 20th, we have our final presentation on Self, how to protect yourself from cyber crime. Another plugin, and I'm sure Michael will remind everyone of this, but we have for all of you a free AARP shredding event on Saturday, October 29th, from 10 a.m. to 12 p.m. at Clinton G. Martin Park. That's in New Hyde Park Road and Marcus Avenue, New Hyde Park. There is a registration link, and I'll put that into the chat. But if you're interested in showing up, you can do so. We'll just need you to register, upon showing up. So anyhow, with that said, right back to you, Michael, and the presenters. And again, thank you so much for attending tonight.
Absolutely, and really great stuff there, Bernard. You know, AARP does great work in all of these areas, so it's great having you all a part of this. So yeah, so I'm sorry I didn't mean to skip over that, but it's the most important part.
It's all good.
But yeah, Dr. Larry and Dr. Fogel,
Yeah.
I'm very excited, you know, to see what you guys have to put together.
Okay.
Good.
Oh, but are you able to share your screen there, Dr. Fogel?
Do you see it?
Nope, not yet. At least not on my side.
Okay, we're gonna try this again.
Yeah, sorry about that. You know, technology is never our friend, it seems like. There we go.
Here we go. Okay, we got it going now.
Yep, you're all set.
Yep.
Okay, welcome everybody to our talk about health and hearing and how we can protect our hearing. First, we're going to introduce ourselves. So I'll start by introducing myself and then I'll give the mic over to Dr. Cardano. So my name is Dr. Esther Fogel. And again, my office is in Lynbrook, New York, which is on the South Shore of Nassau County. The name of my practice is Comprehensive Audiology. And at our office, we focus on personalized hearing healthcare. We have state-of-the-art equipment. We work with patients with hearing loss, with tinnitus, and also patients who just want to protect their hearing. And I'm going to give the mic over to Dr. Cardano, who does similar work, so he can introduce himself as well.
Thank you, Dr. Fogel. So I'm Dr. Lawrence Cardano. My patients call me Dr. Larry. And I'm the director of Hearing Center of Long Island. That's in Valley Stream. And we focus on helping people with hearing loss to improve and maintain their quality of life and cognitive function, mental acuity, with proper treatment of hearing loss and tinnitus. So I'm looking forward to today's presentation.
Okay. Let's hope we can move this forward. Okay. So we're going to talk about a few statistics about hearing loss just to get started. So hearing loss is actually, out of all the health problems known to the United States, hearing loss is the third most common health problem amongst adults. Not many people know that how common it is. The first and second most common health problems are heart disease and arthritis. And third is hearing loss, which is even more common than diabetes or some other health problems that you would think may be more common than that. In terms of the numbers, about 30% of adults over the age of 65 have some degree of hearing loss, and about 40 to 50% of adults over the age of 75 have some degree of hearing loss. Okay. And before we get started about the signs of hearing loss, we do want to talk a little bit about how hearing loss can affect a person overall, how it can affect our quality of life. As Dr. Cardano mentioned, that when we treat our patients' hearing loss, it's not just about hearing, it's about how the hearing loss is affecting a person overall with their health and their quality of life, and how improving hearing can improve your quality of life. So just taking a quick look at this, where we have hearing loss in the middle, we can see how hearing can be related to different parts of the body, whether it be your cardiovascular function, cognitive function. It can be related to certain other diseases such as diabetes or kidney disease. It can relate to our overall social well-being and lead to depression if it's not treated. Those with hearing loss can be at risk for falling, for hospitalization. So this just talks a little bit about how important hearing is to our overall health and well-being. And we're going to give it over now to Dr. Cardano.
Okay, thank you, Dr. Fogel. So there are a lot of things that can contribute to hearing loss and put you more at risk for hearing loss. And For example, one of these things is cardiovascular disease. The ear and the brain work together to allow you to listen and understand what's being said. And of course, the ear and the brain are part of the body. So in general, anything that affects your health overall can affect your hearing, but especially some things we're going to mention here. So you see on the list here, cardiovascular disease and high blood pressure. There was a 2001 Egyptian Journal of Otolaryngology article that pointed out that the severity of hearing loss increases with the severity or the incidence, the risk of hearing loss increases significantly with the severity of cardiovascular disease and high blood pressure. You might wonder what high blood pressure would have to, or diabetes, or any of these things would have to do with hearing. The inner ear has a blood supply, and unlike most other parts of the body, the vascular system of the inner ear has no redundancy. So for other parts of the body, if some of the blood vessels are blocked, the vascular system can reroute the blood around that, but that doesn't happen in the inner ear. You notice here also on this list is diabetes. Research is telling us now that even people that have pre-diabetes, meaning that the blood glucose is higher than normal, but not quite in the range where they're diagnosed with diabetes. People with pre-diabetes have a 30% increased risk of hearing loss. So it's if you have diabetes, keeping it under control has a lot of different benefits, but this is an important one. People that have full-blown diabetes have double their risk of diabetes, of hearing loss compared to people that don't have diabetes. You notice also there on the list, smoking. This is something that might sound surprising, but the research is telling us that smokers have a 70% increased risk of hearing loss. And not only that, even if you are not a smoker, if you live with someone that's a smoker, you are doubling your risk of developing hearing loss. There was, but the good news about this at least is that there was an article in the October 2020 Journal of the American Journal of Medicine that said that if you stop smoking, your risk of hearing loss does decrease. So there is hope for it. I know some people would say quitting smoking is not easy. I had a patient tell me once that quitting smoking is very easy. I've done it many times. So it may not be easy, but it is an important thing that you can do to help not only your overall health, but also your hearing. So we have another slide. Okay, so this is something maybe a little more intuitive for most people. If I do a lot of public speaking and a lot of writing on this topic. So if I ask people, do you think hearing loss can have an impact on your social and emotional well-being? Most people will understand that and say yes. I just had a patient yesterday in the office who told me that she was accustomed to going to a diner once a week with her friends. She had a bunch of friends that she knows for years, and every week they would go to the diner. And because of her hearing loss, she actually stopped joining them on those days because it was so frustrating with a group of people there and other noise in the restaurant. And when we treated her hearing loss and got her to improve her hearing clarity, she said that one of the things that she liked, that she was most glad about, was just that she could go to that diner once a week with her friends. So you can see that, when someone has hearing loss, obviously there's a tendency to reduce social activities because they're so frustrating, then that leads to isolation, quality of life decreases, and depression. Something interesting about these things that are listed on this slide is having to do with some of the other things we're going to be talking about, I think, soon. But there's a number of these things here that are risk factors for dementia. So, and we'll talk, I'm sure, about this a little bit later, but hearing loss by itself is the #1 risk factor, modifiable risk factor for dementia. But it also contributes to things like social isolation and depression, which are themselves risk factors for dementia. So this is important, I think, to keep in mind. Dr. Fogel?
Okay. And then on the flip side of that is those, as Dr. Cardano mentioned, who end up getting help for their hearing and wearing hearing aids and can improve their quality of life and increase their social activities and well-being. Okay, so the next topic is something that Dr. Cardano just alluded to, which is the topic of cognitive function and the big words like dementia. And this is a very popular topic right now for the last few years. I'm sure it's been written up a few times in the AARP journals as well. So everybody wants to know how we can improve our brain function and cognitive function. Everybody wants to work on, crossword puzzles and Sudoku and all the things to improve our brain function. So there's a lot of research out there trying to, to determine what are the risk factors for cognitive decline. After many years of research, and a lot of this research was done at Johns Hopkins University by a audiologist and researcher named Dr. Frank Lin. And so they have found that there are a lot of risk factors for cognitive decline, but one of the biggest risk factors is untreated hearing loss. So what happens when a person is not hearing as well as they used to, that can be associated with cognitive decline and possibly even dementia. And some of the reasons for that, #1 is hearing is one of our senses. So in order for the brain to function properly, it needs to receive all the sensory input from our surroundings, whether it be vision, hearing. So when we're not hearing as well all the sounds that we should, the brain is not receiving all the signals that it should be hearing, and that can lead to cognitive decline. Another big factor is something here called listening fatigue and executive function. So what happens is when a person has hearing loss and they're not hearing as well, we have to use a lot of brain power and brain resources just to be able to hear. So many people who don't hear well, they have to exert a lot of effort to hear. You don't hear as easily as you possibly did in the past. And that takes a lot of brain power and brain function, and that can start affecting the cognitive decline overall. Before we go to the next slide, I'm actually gonna turn the mic back over to Dr. Cardano because I understand this is a topic that he specializes in. So I'm gonna let him kick in a few words here to add on to what I said. But
Sure.
what we have found is that, patients who are at risk for dementia or kind of cognitive decline, if they have hearing loss, their cognitive decline can be even worse. And that's why it's so important to deal with the hearing loss to improve, their social well-being as well as their cognitive well-being. But before we go to the next topic, I'm going to let Dr. Cardano talk a little bit to this since I know this is his specialty.
Thank you, Dr. Fogel. I appreciate that. Yeah, this is something that I'm passionate about. I'm sure most people listening to this probably have had friends or family members that have had dementia, and what a heartbreaking thing it can be to see a loved one deteriorate and all the terrible things that can happen as a result of that. So this is something I'm really passionate about and committed to try to help people with. So Dr. Fogel mentioned some very important things there that everybody should know. There's a few other things that I think are interesting important to keep in mind. One of the hallmarks of dementia is cerebral atrophy. It means parts of the brain actually shrink. This is something that and people sometimes are surprised about, but there is research and MRI studies showing that with hearing loss over time, you get cerebral atrophy. It's because the parts of the brain the neurons in the brain that deal with hearing and language are not being stimulated. So, like if you didn't use a muscle for a long time, there's actually physical shrinkage in parts of the brain when you have hearing loss. And I think for most people, if you have any concern about if you have a family history of dementia, or you have any concerns for yourself, it's important to get an audiological evaluation and at least know where you stand. You also, if you have concerns, you can also get a cognitive function screening. But brain function and hearing loss, there's such a dramatic connection. In fact, one of the groundbreaking studies that were done on this was the Lancet Medical Journal Commission on Dementia. They had an article in 2017 and they updated in 2020, and they identified 12 risk factors. Well, first, they concluded that about 40% of cases of dementia are preventable, meaning they're due to risk factors that you can do something about. So they listed 12 factors. The one that had the biggest impact was untreated hearing loss. And I started to mention before, some of the others that they listed, like depression, social isolation, are affected or exacerbated with hearing loss. And actually, something maybe not having, besides hearing loss, they mentioned factors in that study like hypertension, diabetes, and obesity, which are things I think that we want to just, those are things that contribute to hearing loss. So just to keep in mind that whatever you can do for your overall health is going to be good for your hearing, and whatever you can do for your brain is going to be good for your hearing and listening ability. So thank you, Dr. Vogel.
Okay, so we spoke a little bit about how hearing, can affect us overall brain function or social, emotional, or overall medical well-being. And we're going to, in a couple of minutes, get into some signs of hearing loss and what we can do if we have hearing loss. But I do want to take a quick detour just to talk about a topic that is just relevant to our times over the last couple of years with the recent COVID-19 pandemic. So this has affected our lives overall, but we're going to be talking about how it has affected hearing. So COVID-19 is a virus, like many other viruses, and viruses are known to affect hearing. So there have been documented cases, and it's still being researched about the numbers and statistics. So I'm not going to go into numbers right now, but it is known that people who have had COVID have had side effects of hearing loss, residual hearing loss, as well as tinnitus or any type of ringing in the ears, and vertigo, all which are related to the ear. So if you or someone had COVID and is starting to have any of these symptoms, they definitely should have their hearing checked. So they should be seen by an audiologist and possibly an ENT. And then one other thing related to COVID-19 was just how it affected people's communication and hearing overall. So As we mentioned, hearing loss, one of the main reasons why we need to treat people with hearing loss is to help them with their communication and their overall well-being. So during the pandemic, many people were isolated anyway because they had to stay at home. And both people without hearing loss, but even more so people with hearing loss, were affected even more because of the social isolation. So many people with hearing loss rely a lot on speaking to people face-to-face, lip reading. So if they were at home and they had to talk to people over the phone, that became very difficult. The same thing with masks. Masks cover our faces, and it's hard to have a conversation with people when they're wearing a mask. All of us, whether we have hearing loss or not, do rely a little bit on seeing people's faces, seeing their, overall facial expressions and reading their lips. So again, wearing masks was a little bit difficult and many of us are still wearing masks now in our office when we're seeing patients. So that's just something to keep in mind with the masks, how much more difficult it is for somebody with hearing loss to have a conversation when you're wearing a mask. And then we relied a lot during this time on phone calls that we spoke of before, but for people with hearing loss, it may be helpful to do more of a video kind of call where they can see your face, whether it be Zoom or FaceTime. And then we relied a lot on telehealth, which even with hearing health, we were able to do some visits through telehealth over the phone or remote into people's hearing aids. So this was something that did and will probably continue to affect us going forward with hearing and communication. And now I'm going to turn the mic over again to Dr. Cardano, and he'll start talking about some signs of hearing loss that we should look out for.
Right. So you can find lists of signs that you have hearing loss, all over the place. The CDC came out with a list of 10 signs of hearing loss. You'll find lists, other lists. I just want to mention these are important to know about. I do want to make a caveat though before we go through this. Even this is important. The caveat is that self-perception of hearing loss is notoriously, not reliable. So, we all have, every audiologist sees patients who will tell them, my hearing is not bad, it's just that nobody speaks properly, right? Or, things like that. And when really they have significant hearing loss. And also because hearing loss happens, generally the most common type of hearing loss happens very gradually, even without willful denial, it's not easy to notice something that occurs very slowly. So we don't want to, it's not a good idea to depend on self-perception. You really should have an evaluation. People ask, when should I have my hearing evaluated? What we tell patients is, it's something like if you ask a doctor when I should have a colonoscopy, usually they say you really should have a colonoscopy around age 50. That's about when we recommend people make sure they get a hearing test. So a colonoscopy and audiological evaluation, the phrase is rears and ears. But if that'll help you remember, I think that's something. But so we have a list here. This is something that these are things that really are good to notice. Sometimes the friends of family members will notice the person having hearing difficulty before the person with the hearing loss. So when people seem to mumble, I mean, I've had patients that are convinced that their spouse is mumbling, and we tell them, well, we have a way to stop that person from mumbling by correcting your hearing loss, and or asking people to repeat themselves, difficulty in noisy situations, turning the volume of television up. sometimes that's helpful, but I've had cases where patient will tell me, well, my hearing doesn't seem to be too bad because I'm not turning the TV up much louder than my spouse. And we check, come to find out that their spouse has a significant hearing loss. So that's something to keep in mind. It's not always reliable. There are some other, common sense things. The last one, bringing buzzing and hissing sounds in the ears, that's what we call tinnitus or tinnitus. And you might wonder, well, what would that have to do with hearing loss? We're not talking there about trouble, hearing somebody. And the reason why that's important is because in most cases, not every case, but in most cases, tinnitus is a neural consequence of hearing loss. It has to do with the breakdown in the neural connections between the inner ear and the brain. So I think these are helpful things to keep in mind, just to say that it doesn't substitute for an evaluation.
Yeah, and something else that we forgot to put on the list, but the most common things that I hear people saying, Dr. Cardano, you could tell me if you agree, is people will say, I hear, I just don't really understand what people are saying, or I could hear, but it's not clear. So usually that's a sign of some degree of hearing loss.
And that's a very good point Dr. Fogel makes there. And the what's behind that is a kind of an interesting fact that all the research is telling us now that you can have at least 50% of the neurons, the neural connections between the inner ear and the brain not functioning properly and still have normal loudness perception. So if you do a hearing, what people think of as the standard part of a hearing test where you're listening for beeps, you might be able to hear those beeps at a normal loudness level, even though 50% of the neural connections between the inner ear and the brain are shot. But but even though you have normal loudness perception, you may have other issues like what Dr. Fogel was mentioning with clarity, difficulty with background noise and tinnitus and things like that. So that's a good point that Dr. Fogel makes.
Okay, so what can we do if we suspect that we have hearing loss? Okay, so first thing, as Dr. Cardano said, is never assume that what you perceive is true. So you have to have at least a baseline hearing test, have your hearing tested. And then protect your hearing. So Dr. Cardano, do you want to talk a little bit about how we can protect our hearing?
Right. Now, there's two aspects of your hearing that need to be protected. One is, there's two aspects of hearing in general that we think of it just in a simplified way: loudness and clearness, right? So protecting your hearing from loss of loudness. There are some things like that people can, I think, anticipate, like loud noise. There are situations with loud noise, ototoxicity. There are some medications that can affect your hearing. There is, though, one risk factor for hearing loss. Actually, for most people, the statistics tell us that the biggest risk factor for developing hearing loss for most people is something that you probably do not want to avoid, even though it's going to increase your risk for hearing loss. And that is staying alive and living longer and getting older. Age is for most people the biggest risk factor for hearing loss. The older you get, the more chance you have to develop hearing loss, no matter what you do. But you can do things like eat healthy, exercise, take care of your general health, as we said earlier, to reduce or slow down the progression of hearing loss. There is another aspect of hearing, though, that sometimes people don't think about, and we started to mention it earlier: clarity. So you know that you can have loudness without clarity. And all the research is telling us is that if you have any hearing loss, even a mild hearing loss, the way to preserve, the easiest way to preserve your hearing clarity, not the loudness, but the clarity, is to have it treated and have properly fitted and maintained hearing aids. It's back to that saying of use it or lose it. You want to have the acoustic stimulation to the brain that without which the clearness of your hearing will deteriorate. But in general, protecting yourself from loud noise, being careful about ototoxic medications, and then taking care of your general health are all important things when it comes to hearing.
Correct. And the last thing on the slide was, as Dr. Cardano said, if you are diagnosed with any type of hearing loss, even if it's mild, it's important to treat it early so that you could preserve the hearing and the clarity of hearing, speech, and conversation. Okay. And just a few communication strategies to keep in mind. If you have a family member or a friend that has hearing loss, and these are good communication strategies, even if you don't have hearing loss. But if you do have a family member who has hearing loss, even with properly fitted hearing aids, there's some communication strategies to keep in mind, such as it's good to communicate face to face. Talk to someone facing them. Don't turn your back. Don't walk away while you're talking to them, and don't talk from another room. So a lot of times people will say, I hear my spouse talking to me from the other room, but I don't understand what they're saying. It's difficult to hear from another room. So it's always important to talk from the same room. Minimize background noise if possible. So sometimes you're in a situation where you can't control the background noise, but if you're in a situation, let's say a family gathering or dinner, try to turn down any loud background music or anything that's going to interfere in the conversation. Same thing if you can maximize the lighting in the room. So it may be nice to have a dimly lit dinner. It may add to the mood, but if someone has hearing loss, it would make it very difficult for them to be able to read your facial expressions and read your lips. So try to keep the lights up, and also speak clearly, do not shout. So if someone has hearing loss, it doesn't always help to shout or raise your voice. It helps more to speak clearly, maybe in shorter sentences. Sometimes shouting can actually make it worse for someone who has hearing loss. Anything you want to add to that, Dr.
Yeah, just
Cardano?
I think those are all important things that you mentioned, Dr. Fogel. Just one other thing. We know from all the research that when a person starts to have hearing loss, the speed at which the message goes from the ear to the brain slows down. The neural transmission is slow. So as you said, shouting doesn't help. What helps more for most people than talking louder is talking slower. You may be talking faster than the other person is able to listen. So there's some research saying that there's some really significant increases in comprehension if you'll just talk a little bit slower than normal. So sometimes part of this is educating. Sometimes if you have friends or family members, you can educate them about these things that they can do. It may take more than one reminder though. So just a warning about that, but these are all helpful things.
Okay, thank you everyone for joining us. And here is our contact information. If any of our viewers or listeners have any follow-up questions or would like to have their hearing tested, you can reach either myself or Dr. Cardano. Here's our contact information, and we'll turn over the mic for any questions.
Wow, that was absolutely fantastic. And, thank you both for that. And, and I'm sure Bernard, and we have some questions from the audience as well. And I know Bernard has some, but, and I know you might have touched on this a little bit, but just out of curiosity, is balance tied into hearing a lot? Like from my understanding, balance is part of your ear as well. So, I mean, if you're having hearing issues, could that also be something that, that would affect your balance?
It's a good question. Actually, I was just talking to a physical therapist the other day, and people who have a mild hearing loss have a 300% greater risk of having a serious falling incident compared to people that have no hearing loss. And after that, for every, this is something also Dr. Lin, that the researcher that Dr. Fogel mentioned, studied, it beyond a mild hearing loss, the risk of serious falling incident increases about 140% for each 10 decibels of hearing loss. So there's a number of different connections between balance and falling incidents and hearing. You know, falls are the number one cause of accidental death and accident-related injuries in senior citizens. So it's an important topic. There is a part of the inner ear that has to do with balance. It's not the part that has to do with hearing. So there is some relationship there. It's not always the same thing. But there are generally two reasons that people, the researchers think of why hearing loss can increase the risk of serious falling incidents so much. One is situational awareness. The physical therapist I was talking with said it's very common for older people to have a falling incident where they're tripping over their little pet. So if you're not hearing it as well as you should, if Fido is coming up behind you, you don't hear his little paws on the linoleum. But being aware of your surroundings, you're less aware. The other factor is something we might have mentioned before, cognitive overload, meaning that if you're putting, because of a hearing loss, you're putting more mental effort into listening to what's going on and trying to figure out what people are saying, don't have as much cognitive reserves left to devote to what is actually a complex, task of maintaining your gait and balance. So there is a relationship between hearing loss and, balance and falls, which can be helped by treating hearing loss.
Excellent.
Yeah.
Bernard, don't you have a question, don't you?
I always have questions. and as a Gen Xer, I spent a lot of time at nightclubs and cigarette smoked filled bars and concerts and the Walkman radio. I mean, I'm thinking, so does not taking care of your hearing earlier in life, does that contribute to where you are today?
So, we spoke about a lot of risk factors for hearing loss.
Right.
So there are many things that can lead to hearing loss, and some of them are in our control and some of them are not in our control. So for example, if you have family history of hearing loss, or if you have family history of other diseases, sometimes that's in your genes, but there are certain things that are in our control. And one of those is exposure to loud noises, whether it be loud concerts, loud Walkmans, or people who work at any age in factories or places with loud machinery. So yeah, we don't always think about it when we're younger because we think we're invincible. But if you have any young members of your family who would be exposed to loud noises, concerts, maybe they're a musician, maybe they work in, maybe they like to go to sporting events, or they work in a place where there's loud machinery, definitely it's important to protect your hearing, even at a young age with earplugs. There are things, even earmuffs. Myself and Dr. Cardano both offer custom-made earplugs if necessary for different types of professions. But yes, it is important to think about that even from a younger age.
Right.
That's an important point that Dr. Fogel makes. There was actually a research article from, I think it was Harvard, that on this topic, and there's a phrase in the title of the article, something about misspent youth. But the research is telling us that the way exposure to loud sound affects hearing loss, it's something like what happens with skin cancer, where if you have a lot of exposure to sun when you're younger, the skin cancer may not show up right away, but it predisposes you to skin cancer later in life, even if you stop going in the sun.
Sure. That makes sense.
So unfortunately, that seems to be what happens also with hearing loss, is that the early exposure to loud noise may not show up as noticeable hearing loss right away, but it's predisposing you later on. So that's why if you have younger family members, Dr. Fogel's advice is good advice to take.
Absolutely.
Yeah.
Question, what about earwax? If you develop a lot of earwax, if earwax is impacted, does that contribute to hearing loss?
I can respond to that. You know, I have a friend who's an audiologist, and he's trying to get his daughter to become an audiologist. And she said, "Oh, you mean I have to look in people's ears and deal with earwax? Forget it. I'm not going to do that." But we deal with earwax all the time. And so in our office, we do, it's called cerumen management. That's cerumen is the technical word for it. And fortunately, earwax only actually stops or affects your hearing if it's blocking the ear canal solid. If there's a pinhole in the wax for the sound to get through, it's not what you want. It will interfere with the function of hearing aids, and it is harder to get earwax out if it's been there longer and dried up. It's normal to have some earwax. If you don't have any earwax at all, that can be the sign of some illness and something being wrong. Earwax has some functions. It's antibacterial and so forth, but you just don't want it to build up too much. So if there's some research that says that people had less trouble with impacted earwax before Q-tips became available. It's a lot easier to push the wax in than it is to get it out. You know, when we do it in the office, we use microscopes under light, so we can look in the ear and make sure that we're seeing what's there. So earwax can be a factor. Fortunately, it's generally something that can be taken care of if you're aware what it is.
Yeah, and as Dr. Cardano alluded to, it's not a good idea if you feel that you have a lot of wax. It is not a good idea to try to get it out on your own with a Q-tip or any other tool. I have had patients try to use, I will not even name the tools because I don't want to give anybody ideas. But better if you suspect that you have earwax to see a doctor, an audiologist, an ENT, your primary care, to help you get it out, because many times when you try to get it out on your own, you're actually making it worse, or you can injure your ear canal or eardrum.
Yeah, Dr. Fogel, I wonder if you have the experience that I've had. When you try to get patients to stop using Q-tips, is that sometimes difficult to convince them?
Oh, yeah.
Because it feels good, right? It feels like you're doing something. So, but we try to educate patients.
So a question that we have, from the audience is, and this is a really good one, is, because a lot of people probably have not really done this. What can you expect? Like, what can someone expect when they come in for a hearing test? Like, I mean, is this something that they have to spend all day doing? Is it something they have to fast 24 hours for? I mean, what is it? What are we talking about when we talk about a hearing test?
Dr. Fogel? Yep.
Yeah. So you do not have to fast ahead of time, and you don't have to do any preparations. Do not try to clean your ears with a Q-tip before you come to the audiologist. People think, before they go to the dentist, they're going to quickly floss their teeth or something like that. And so I've had plenty of people come in thinking they're going to clean their ears out quickly before they come and injure themselves. So no, you do not have to do any preparation that way. You should keep in mind some questions that you have for the audiologist. Keep in mind some situations where you'd like to improve your hearing. That I would say would be the only preparation. I would say an initial consultation could be anywhere between an hour, maybe an hour and a half, depending on the office that you're going to. As the audiologist, we're going to take a full history, just like we spoke about in our presentation. Hearing can affect a person's overall health and well-being. So we like to get a good history about everything, about your medical history, about your social history, about what type of situations you need to hear in, your work history. And it's really just so that we can help you hear better if you have hearing loss. So we'll take an initial history, and then we'll do the actual hearing test, which is painless. Okay. So in most cases, you'll be put in a soundproof booth. There are a few parts of the test. Part of it is listening to some beeps. Part of it is listening to words, maybe sentences. Maybe there'll be some background noise to make it harder for you to hear. After we do, and then we also take some functional measures of the ear. We look at the eardrum movement. We look at how the little hair cells in your ears are working. We do a few other tests as well. Then we will review the results and discuss how the results and how they are affecting, how that syncs up with what you're reporting, how the hearing is affecting you in everyday life. And most of the time that will sync up with the results of the hearing test. And then we'll talk about some treatment options or prevention options to protect your hearing. Dr. Cardano, anything you want to add about that?
So that's good. Just a few quick points. People should know that the standard audiological evaluation that audiologists do is a diagnostic test. It will tell you what whether your hearing loss has to do with something physical like a hole in the eardrum or infection versus what we would say the normal wear and tear on the nerve for hearing. So it is a diagnostic test. That's the standard audiological evaluation. We do more than what's standard, but those are important things. And we talked earlier about the difference between loudness and clearness. So those are both things that that you'll find. What some of the things that you'll find out from your evaluation is how loud sounds have to be, how loud different sounds have to be, and also what the status of the clearness is, how your hearing is affecting the way your brain is able to make out words in conversation. So those are important things to find out from an evaluation.
Yeah, and just to go back on what Dr. Cardano said, that while we're doing the hearing tests and we are doing various tests, we do try to diagnose if there are any additional medical issues besides just the hearing. So Dr. Cardano alluded to that in some cases it is just the hearing loss, and we can make recommendations for treatment options for the hearing. But sometimes by doing our tests, we may find a medical issue such as a hole in the eardrum or an ear infection or any other kind of medical issues that can lead to hearing loss. And then, we would refer you for, further evaluation of that medical issue that can be affecting your hearing. So we do look at that as well.
One of the things that you mentioned, Dr. Fogel, right now was about ear infections, and and it kind of reminds probably a lot of us when we were younger, where we probably had a lot more ear infections than we do now. And probably as we get older, we might start seeing them again. Somebody from the audience asked, what are some of the leading causes of ear infection, and can that reveal like any other other underlying diseases that may be affecting your ears or your hearing or anything about that?
Well, there are different types of ear infections. What you're referring to was, childhood ear infections are mostly what we call a middle ear infection. And that's usually related to, kids get a lot of colds and viruses they may catch from their friends in, playgroup and so cold can lead to overall stuffiness in the nose and then can spread to the ears and cause that type of ear infection, which we know are treated usually with antibiotics. As adults can develop that type of ear infection as well, but some adults can develop outer ear infections or funguses or other viruses. If that's something that we find, we would, refer for proper treatment. Then there's other, issues that can affect the hearing nerve as well. And again, those are all things that we look out for.
Excellent. Bernard, I'm sure you have another question.
I was just thinking about whether or not you see in study, is it more prevalent among men or women, or it's 50-50 in terms of hearing loss? I mean, my wife would would try to answer that question and say, I can hear her already. So,
Well,
so, yeah.
men definitely have selective hearing, but for the statistics, I will refer you over to Dr. Cardano.
Well, most of the statistics on that in the past have shown men to develop hearing loss sooner than women. And it seems to be like men develop all kinds of ailments sooner than women, but hearing loss is one of them. There is some debate, though, about whether that could be because, at least in the past, men have been involved, maybe, as in general, in more noisy activities with, power tools or motors and things like that. So the jury is kind of out, but that's kind of the theory that that may be something that that has to do with the differences. Yeah.
Gotcha.
We'll see if that'll change over the next generation.
Yeah.
Well, like if you have, so if you always say you're struggling hearing, say like high notes, but you can, but you hear other things, is that worth going to, to see what maybe even consider hearing aids, or, or should you wait for something that's a little more broad?
Dr. Fogel, do you want to?
Yeah, so when we do a hearing test, we're testing, as you called, the different notes or different frequencies or pitches of sound. So we're testing, some low pitches, some mid pitch, some high pitch. Now, for hearing to be considered normal, then a person has to hear all the sounds normally. If there's any degree of hearing loss at any note or pitch, whether for some people it may be in the high pitch, for some people it may be in the low pitch, depending on the cause of hearing loss, that can affect how a person is hearing speech and words and conversation. So the most important thing for hearing that we're looking at for the hearing test is how it affects our communication and hearing other people, which would affect your quality of life.
Right.
And if a person is missing out on any of the sounds, then they could be missing out on some of the clarity. So that goes back to what some of the discussion we had before, that it's not only important to hear that someone's talking or to hear the volume. We'll say, I hear that someone's talking to me, but I don't understand everything they're saying. That's usually because you're missing out some of the tones. It could be the high tones, it could be the low tones. So the general answer to that question is yes, if you're missing out any of the tones, it is important to get a hearing test and possibly even have treatments such as hearing aids or devices, depending on your hearing loss, because, we don't want to wait till you have, lose all of your hearing. We want to treat you early when you're even missing some of the sounds, because that's going to affect the clarity of what you're hearing.
That's important. It's just one thing I'd like to add to that. That's very important information, I think, that Dr. Fogel just talked about. I think you just want to remember, as I started to mention earlier, if someone has lost hearing for high-pitched sounds and needs high-pitched sounds to be louder than normal to hear them, we have to keep in mind that you can have 50% of the neural connections between the inner ear and the brain not functioning properly and still have normal loudness perception for all the sounds. So by the time you actually have that measurable loss in loudness for high-pitched sounds, you now have more than 50% of the neural connections between the inner ear and the brain not functioning properly. And one of the things about treatment, Dr. Fogel was saying that we're thinking about not just loudness, but clearness. And of course, most people who have hearing problems, they're talking about clearness. I have yet, this typical part of the hearing test that everybody knows about is listening to the beeps. I have yet to have a patient come to my office and say, Dr. Cardano, I'm concerned about my hearing. I'm really concerned because I have trouble hearing beeps in a soundproof booth. That's not what people are concerned about, right? They're concerned about clarity. And you can have clarity problems before you have loudness problems with very mild levels of hearing loss. So by the time there's a noticeable drop in the loudness for high-pitched sounds, you're already, well into that progression of hearing loss. So that's a good question.
Yeah, and just one thing, since you asked specifically about those high tones or high frequencies. So, as Dr. Cardano mentioned, we're looking at a lot of things in our hearing test besides for just raise your hand when you hear the beep. Okay, so one of the things that we spoke about is that in order to hear, we need both our ears and our brain. So the ears pick up the sounds and then the brain has to process the sound. One of the things that those high frequency or two of the things that the high frequency notes helps us with that is very important to day-to-day conversation. So those high notes help a person determine which direction a sound is coming from, which is very important. So you're walking down the street and someone, you're trying to cross the street, we're talking about just for safety, and a car honks at you, or you're walking down the street and someone starts calling your name for whatever reason. Those are all things that are important just for safety, regardless of conversation. And when a person has high frequency hearing loss, they start to lose their ability to localize, which means to determine which direction a sound is coming from. So that's very important just for safety. In addition, the high frequency sounds help us in a noisy real life situation. So one of the biggest complaints that we get, as Dr. Cardano said, nobody says I can't hear a high frequency, can't hear a high note. People will come in complaining when there's a lot of noise at a party or restaurant, I can't understand what someone's saying because of the background noise. Now, those high frequency sounds are what helps the brain filter out or separate one sound from another. So if a person has hearing loss just in those high frequencies, they're going to experience a lot of difficulty hearing conversation and understanding conversation in real life noisy situations. So those are just two more reasons why, treating your hearing loss just for high notes is important.
Excellent. And I just wanted to, we have so many questions where I'm sure we'd love to get to all of them, but we are running out of time, unfortunately. But I did want to thank, Dr. Esther Fogel from Comprehensive Audiology. She's the doctor of audiology from there. And it's also Dr. Lawrence Cardano. He is the director of audiology at the Hearing Center of Long Island. And I mean, such great, fantastic information. And, thank you both so much for that. And don't forget, we have two more of these webinars that are coming up with AARP Long Island. We have on October 13th, 6 o'clock again. So, get your dinner and sit down and, and join with us and learn about great stuff. Next week on October 13th, as part of National Financial Planning Month, we are going to talk about wealth and protecting your money. Very important stuff. I think our money's important. We have to make sure we have it. And then on Thursday, October 20th, also at 6 o'clock, and this is part of National Cybersecurity Awareness Month. We're going to talk about protecting yourself against cybercrime, and all of that comes together. And Bernard and Macias, tell us a little bit. It's all coming together then on Saturday, October 29th, right?
Right. Then we have our shredding event, and I did put it into the chat box on October 29th. That Saturday, 10 a.m. to 12 p.m. We have a free AARP shredding event. So please come down and shred with us. Great way to protect yourself. Also, if you want to connect with AARP Long Island, you can do so by checking us online at aarp.org/local. You can learn more about these type of events that we have. We have classes and wellness tips and lots of other upcoming events, volunteer opportunities. If you're interested in volunteering with us, you can check us out there. You can also find us on Facebook at facebook.com/AARP Long Island.
Excellent. And by the way, and if you want to register for any of those events, just like how you registered for this one, it's liherald.com. But for the next one, it's /wealth. And then for the one after that, /self. Very easy. But you can also just register for all three, for this one and the other two. So, come online and join us. And then also register for the shredding event. The shredding event it's a great time. I mean, we did it last spring and it was fantastic. A lot of people showed up. It's a great opportunity to get rid of some of that stuff and not have to worry about it turning up in places that you don't want it to turn up at. So, so we look forward to having you all there. Dr. Larry, Dr. Fogel, thank you so much. Bernard, thank you so much.
Thank you.
Thank you. And thanks to AARP.
Thank you, everybody.